Martin, how did you feel when you were given the diagnosis of arthritis?
Well, I'd obviously suspected that was probably the problem for a while, given the problem I had with my joints. So getting actually a positive diagnosis was actually quite a relief to an extent, because I think when you know what the problem is, it gives you some hope that there will be treatment that will affect and come a long way.
Did you have any other feelings about being given the diagnosis, a sense of apprehension at all?
I think the problem with getting an arthritis diagnosis is that I think everyone knows that it is something which tends to affect largely older people, and it keeps going for a long time. So you don't know quite what the future holds, and there's obviously a certain degree of apprehension, because I have a sense that the arthritis may just, unless we could treat it, it may just get worse and worse over the course of time.
Could you tell me what your feelings were when you were told you needed to start methotrexate as a drug?
Methotrexate wasn't something I'd heard of before, and it was explained to me it's quite a strong drug, and it was also used for cancer treatments, and I was quite surprised to realise things seemed serious enough that I was actually getting prescribed such strong medication. So I suppose there was a degree of apprehension on that, just because it did seem quite a serious drug to be being put on.
How did you find having blood tests carried out regularly when you started methotrexate?
I started off having blood tests, I think, every couple of weeks, and the regularity of them has varied depending on precisely where I am in the treatment. When I first started the blood test, I think it underlined the fact that this was quite strong medication I was on, but other than that, the blood tests themselves were not a problem.
How long did it take before you actually noticed some improvement in your symptoms after going on to treatment?
I think I was told originally that I could probably expect to be on the treatment for some weeks before it actually started to improve. And I think that was probably the case. There was certainly improvement, and when I started taking the methotrexate, it took a while to stabilise, in that it would get better, and I thought I was better, and then things would flare up again and improve, and it took a while before it would all settle down. But there was an effect fairly quickly, but it was a while before it actually seemed to be utterly, completely sorted out.